morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can also make use of it. My dear friends, we are discussing about approach to fever in children. After looking into the basics in so many classes, in the last class I have discussed one important case so that it is quite easy for understanding. Today we will see another case, that is case number 2. Now you just think over it because all of you know the basics. Mother is coming with her child, complaint is fever, and when you ask the questions, remember the 5 important questions that you have to ask. The onset of the fever, according to mother, it is very high. So when mother says the onset is very high, sudden onset, high fever. So high fever can be seen in case of viral infection, maybe in case of bacterial infections, or maybe malaria, that means parasitic, or even in case of autoimmune, you can have high onset of fever. The next question that you have to ask is about the interfebrile period. When you ask the interfebrile period, so mother is telling that in the interfebrile period, child is not happy looking. Child is sick looking. He is confined to the bed. He is not so active. He is not playing. Very important presentation now. So when the child is not happy in the interfebrile period, probably it may be a bacterial, probably it may be a parasitic, or probably it may be a immune, because in a viral infections usually child is a happy or happy looking, good looking in the interfebrile period. So onset of the fever is acute and high fever is there, and child is sick looking. So now viral infection is excluded. Now we are left with only 3: bacterial, parasitic, or immune mediated. Go to the next question, that is rhythm of the fever. What about the rhythm of the fever? Mother is telling that rhythm is very regular. Okay, rhythm is coming very regular, and according to mother, the fever is coming in every 3 or 4 hours of gap. The rhythm is a 4 hours gap. That rhythm is maintained. So now when the rhythm is maintained, that is also very short rhythm. 4 to 5 hours is a short rhythm. So we know that in case of immunological fever, we will have long rhythms. So but here it is short rhythm. Sick looking child with a short rhythm, acute onset of the fever. So now as the rhythm is regular and short, so immunological fevers are get excluded. Virus is already excluded. Now the immunological is also excluded. So now we have left with 2 important things. One is either it is a bacterial or parasitic. In a parasitic, there is no rhythm. Okay, parasitic fever does not maintain any rhythm. It is erotic. Okay, so there is no rhythm is maintained. But here the rhythm is maintained. So parasite is also excluded. So what we left is now it may be bacterial. It may be bacterial. Ask the next question: what is the trend on day 3? As the day passes, what is the trend? Mother is telling that in the first day fever is less, second day it is still more, and third day it is still more, it is going to the peak. That means as the day passes, the fever is getting worsened. So that is a typical nature of bacteria. Okay, so when you complete the 4 questions, you come to the diagnosis also. So this is definitely a bacterial fever. Now go to the last question. Look into the last question. Any associated symptoms? Mother is telling that for the first 3 days there is no any symptom, only fever was there. But today morning onwards he has got throat pain. Now the things are very clear. Associated symptom is throat pain. That means that it is a bacterial fever which is get localized in the throat area. Probably this is a case of acute tonsillitis, acute bacterial tonsillitis. So this is the way when you go by 5 questions, when you ask the 5 questions, so diagnosis will be there in your hand and there is no scope of missing at all. Now this is if you want the explanation. Now in this case, it's acute onset with the throat pain. There is no rhinitis, and if it is viral, there will be running nose, sneezing, etc. Therefore it is not viral. Okay, so this is just we are giving the interpretation. Already the diagnosis is over. Okay, this case is not a viral case because the interfebrile period is sick. Okay, although it is acute onset, although rhythms are maintained, interfebrile period is sick. So you cannot get a sick interfebrile period in case of viral infections. So one thing. Second thing is, in case of viral infections, you will have multiple symptoms. Okay, if it is a viral infection, a viral fever, you will have multiple symptoms. So you will have fever, cough, cold, sneezing, nasal blockage, etc. But there is no such things. Only fever is there. Okay, so virus is always causing a disseminating disease. It has multiple systems are get affected and multiple symptoms will be there, which is not seen in this case. Suppose if there is high fever and sick and worsening on day 3, but there is no throat pain. Okay, now suppose in this case, if you see high fever is there, okay, child is also looking sick in the interfebrile period, rhythm is maintained, the fever is also getting worsened as the day passes. Okay, then definitely we can say it is bacterial fever. But if there is no throat pain, the diagnosis is again difficult, because we should consider this as stage as bacteremia stage. Okay, bacteremia stage. We have to wait for the localization. Fortunately, on the 4th day, child started with the throat pain, so which helps to localize the fever. Now this fever is definitely localized to throat, maybe tonsils. Therefore, it is acute tonsillitis bacterial origin. And so this is how we have to look into the case. This is case number 2. In the next class, we will again come with another important case, so that we never miss the diagnosis of fever. Thank you very much.